Hi, good afternoon. I'm Andrea Dugas. Oh no. I'm from Johns Hopkins University, and I'm going to briefly discuss Google flu trends and how we can use this in some of our other surveillance systems to find new applications specifically in clinical healthcare settings. So we've discussed a lot of different surveillance tools today, both new and old, but what's equally important as these tools is what we do with them and how we design them and apply them to improve public health or even individual health. Currently, most settings like hospitals aren't really using these surveillance tools very much for their operations planning, which is one potential use beyond just public health planning that we could use them for. So one example of that is for influenza. So each year, influenza outbreaks cause emergency department crowding, which then leads to delays in patient care and ultimately poor outcomes. But perhaps with early warning from surveillance systems, that could trigger some sort of rapid response that would mitigate this expected crowding and ultimately improve overall care. I'm sure you all know about Google Flu Trends, which uses internet-related Google flu search terms to monitor for influenza, and they've now actually designed this down to the city level, which is ideal for a hospital. And Google Flu Trends is also free and easily accessed online, which hospital administrators, clinicians, whoever needs to have access to this data for future planning can easily access beyond just some of the sophisticated systems specifically for epidemiologists. Using this, we designed a study to first validate Google Flu Trends in the city level, and then to take that to see if it correlates with markers of ED crowding that we commonly use. So in order to do that, we basically just took the required data over a 2-year period, including the H1N1 outbreak from one center in Baltimore, and we downloaded Google Flu Trends off the internet, which is incredibly easy to do, confirmed influenza cases, ILI cases that are reported to the CDC, and then basic ED crowding metrics. Then we did a cross-correlation of each one of these metrics with Google Flu Trends to see what the correlation is, and we allowed for different lags to see when the optimal correlation was, which didn't really matter because it was all either 0 or 1 week, meaning that the highest correlation was basically in real time with what was happening with the Google Flu Trends. So as you can see here, Google Flu Trends correlated really well with positive influenza cases in both the adult and in the pediatric populations. However, there was a false positive signal when H1N1 broke out in April of 2009, and then there was a missed peak when the actual H1N1 hit Baltimore. So this demonstrates one of the problems with social and internet surveillance is that it's based on public perceptions of a threat. However, these peaks are not really without merit because you'll see later on that the ED volumes also increased during that false positive peak in April 2009. So even though there was no influenza, it did have an impact, and public perceptions apparently also impact emergency department crowding as well, which is what we are ultimately trying to measure, at least in this study that we are working on. So this is just the validation with influenza-like illnesses, which is what Google Flu Trends aims to correlate with. And again, you're seeing strong correlations with both the adult and the pediatric population. You do see here the high peak of the pediatric volume, which is in blue, and 40% of the total ED volume was coming into the emergency department with ILI during the peak of the H1N1, which is just profound. And so then you can see with such a high volume of ILI that naturally that's also going to be really driving the ED volume in the pediatric ED as well, which you see here. So the pediatric emergency department volume correlated pretty well with Google Flu Trends, but the adult did not. Again, probably driven by this high prevalence of ILI in that population. And you can also see there the peak that corresponds with that fear week, or when people were worried about H1N1 even when it wasn't necessarily there. And this 74% increase in the ED volume in the pediatric ED just demonstrates the need that we need to be able to implement something to offset that crowding to help manage it. So the remainder of the ED crowding metrics were similar. The pediatric ED tended to have a better correlation than the adult ED, especially with left without being seen. The adult ED had not that great a correlation, maybe some with the lower acuity patients. And I just want to point out here, like actually some other people have referenced, this is all correlative. None of this is predictive. And so in order to actually be using this and implementing this for clinical uses, we need to develop additional predictive models, which we've heard about a little bit earlier, before we can really do this, but it's very promising. And so overall, I think we can say that Google Flu Trends, especially even down to the city level data, correlates well with confirmed influenza cases and ED-ILI visits in near real time. And it also does have strong correlations with pediatric crowding measures and some minor correlations with adult kind of lower acuity crowding. And overall, this is just part of the kind of broader impact of, how are we using surveillance? What are we doing with it? How can we affect change and use this to improve overall health? So I just want to say thank you to my team that I've worked with, and thank you for the conference organizers for having us. It's been a wonderful day.